Good afternoon, everyone. I'm Nicola Thomas, Children's Support Coordinator from the Paul Popham Fund, Renal Support Wales. I'd like to welcome you today to our webinar on funding the refurbishment of the Children's Kidney Centre Outpatient Department. Firstly, I'd like to thank you all for attending this afternoon. And if you'd like to ask any questions, please ask using the Q&A function, and these will be answered at the end of the presenters' presentations. Joining us today, we have Dr Shivaram Hedge, consultant nephrologist, and he'll be presenting on why the project is needed from a patient-centred perspective. Next will be Alison Oliver, clinical service lead for the Children's Hospital for Wales, representing capital planning, presenting on what the project will look like, costs and project implementation. Julie Main, parent and chair of the fundraising committee at the Paul Popham Fund, Renal Support Wales, and she'll be presenting on why first impressions really count. And finally, we'll be hearing from Joanne Popham, CEO of Paul Popham Fund, Renal Support Wales, on why the charity is involved and its fundraising for the refurbishment. Finally, just a quick reminder, if you're using your mobile phone to access this call today, make sure you're connected to the Wi-Fi. And without further ado, I'd like to pass it on to Dr Shivaram Hedge. So here we go. Thank you.
Okay, good afternoon. First of all, I thank Paul Popham Charity for having taken this up. All the staff, all the parents, everybody is so thankful to them. And thanks for inviting me to talk on this. What I intend to do is, from a medical perspective, why this refurbishment needed. But everything what I'm going to tell you is a patient-centered perspective. The reason is that's what we do. So before I tell you a bit more about this, I think it will be useful to understand the nature of our work and our workload. Next slide, please. Right, this slide is not a slide of rising house prices, but it is the increasing number of children with the kidney diseases being diagnosed every year. That means our caseload every year is increasing. Unfortunately, more children are being diagnosed with the kidney problems. Next slide, please. Right, it's children with the kidney diseases. It's not just the kidneys are a problem. They unfortunately come with other comorbid issues. It could be behavioral issues, neurological issues affecting their movement. So they need wheelchairs. They don't grow very well. They will have feeding issues. Many of them have got problems with their lungs, whereas other children might have high blood pressure, and other children have got anemia, and some the kidney disease leads to bone diseases. They are prone for easy fractures, and some of them also have got heart diseases, and while the others can have eye problems, and their vision is severely affected. Next one, please. Right, these children can't be cared by one specialty because they've got such a lot of other issues, which I just told you. So many times, in addition to the physical issues, they will have a lot of psychological issues as well, as you can guess. So we need a multidisciplinary team involving social worker, psychologist, transplant coordinators, renal nurses, play specialists, dietitians, our urology colleagues, and we'll have a batch of junior doctors. So it is a typical, needs a typical input from different professionals. Next slide, please. So it's not just the professionals involved, as there is a lot of progress in medicine, we are relying on a different equipment to care for patients in our clinical area. So we got to make space for all these things, which is a simple example is, we need a various printers. Some printers print only the letters, some print the lab forms. We need a different printer to print the prescriptions. We need equipment for blood pressure measurements, height measurements. So as we need all these equipments, we got to find a space in our clinical areas. Next one, please. Right, and in our clinical areas, unfortunately, we are there to communicate what is actually happening to these children. So we might be breaking bad news in that area. We might be dealing with children who have got a learning difficulty or a physical difficulties. And we also speak to family with the psychological issues. In fact, we many times struggle to see what other support we can give it to these children and their families. Next slide, please. And on top of that, as you can guess, last year brought on other challenges. So with the clinical areas, we will have to provide an area which is safe, particularly in the pandemic, which is we got to provide these patients and the parents enough sort of environment for social distancing, and the clinic rooms we might have to keep them separately, because many of these patients are transplanted very recently. They are immunosuppressed. They are prone for very severe, not just a COVID infection, but even other infections. So space is a premium in those circumstances. And obviously, with the PPE needed, we got to have enough supply of them and enough storage facility to store them. Next slide, please. Right, quickly, as you might be aware, CKC was opened in 1999. And then for the next 10 years, we didn't have any updates or refurbishment, anything, until a charity came by in 2010. We had some cosmetic decorations at that point of time. Since then, a lot of things have moved on. We have added a lot of patients, so a lot of equipment, but we remain in the same area. So we need refurbishment. And everything I'm going to say is based on, the nature of clinical work I just told you is based on that. Next question, sorry, next slide, please. I thought I'd just show you the current, this is a clinical area, and particularly this is a clinic coordinator where it sits. There are different printers do different things. You can easily see, or you will struggle to see any spaces, empty spaces there. Next one, please. That is exactly my clinic consultation room where I sit. The flooring obviously could do with update, and the chair, what you see, has got a mind of its own, can go up and down on its own. We need different equipments, chairs, tables. Next one, please. And this is where, at the clinic coordinator area, where we store the notes. So in between, people need to manage to walk through them. Next slide, please. So as you might have guessed from what I've shown you, when we are faced with, over the years, increasing numbers of children diagnosed with the kidney diseases, we got to find a space to see all of them. In fact, we see around 50 to 60 children per week. So with the increasing workload, we are finding our clinical areas currently, including the waiting area, is highly inadequate. And many, unfortunately, although it is very rare, sometimes children can get a little bit poorly when they're waiting. So we struggle to sort of give them emergency care. In fact, our area, it's slightly difficult to accommodate any emergency bed to be brought in there. A few years ago, when the new children's hospital was built, the hemodialysis unit, which used to be in the Children's Kidney Center, that was relocated to the Children's Hospital. Now, that space where the hemodialysis was done in a very big room, we haven't managed to use that space intelligently for our purpose. It can easily be converted into about 2 or 3 clinic rooms. Obviously, we haven't had any input into as to what we do with that. So we got to utilize the space properly. Okay, next slide, please. Right, as I was just telling you, many of our patients have got other comorbid conditions. So we got to provide them a safe waiting area or safe examination area. So some of them have got vision problems. So the area what we have needs to be better illuminated. The flooring needs to be new, should be simple, and the spaces should be uncluttered and spacious. And because some of them do come in wheelchair, we got to provide them a space for that. Many of our patients, as I was telling you, they struggle to grow, so they need a periodic feeding, some of them via gastrostomy, some of them via nasogastric tubes. So we should be able to provide an appropriate area for those things. Next slide, please. Right. And in the space what we have, we obviously can't extend because there's absolutely no space. So that implies we got to use the existing space intelligently. We got to reorganize it because this sort of spaces, we use it for different reasons. One is for a clinic consultation by consultants or for the junior doctors. And sometimes we will have to have other professionals who are involved in the patient's care, like a psychologist, dietitians. They can see the family separately. They can offer advice, which will be very, very useful. So we just to accommodate the increasing number of children, at times we do two clinics simultaneously. So for that, we obviously need more space. Next slide, please. So it also implies we got to provide a safe area. As I was just telling you, in a pandemic, social distancing essential. Patient isolation is important, particularly not just during a pandemic. We get freshly transplanted children who are very much susceptible to infection. So we should be able to isolate them whenever they come to a busy clinic. We can't let them sit with other patients or parents. So that we need to find a space. Whereas there are other children who have got behavioral issues. They've got a bone disease, who are prone for fractures. So what the clinical areas we provide should be safe. Next one, please. Right. The other job, what I was telling you about is there are many other things happening in the area. At times, we will be breaking bad news about a child's illness. There are other times we are dealing with a chronic illness where what is uncertain is when the child will go into dialysis, need a transplant, is not exactly clear in the early stages. So it's like a life of uncertainty, so that some parents find it difficult to take it. And the kidney diseases, many times, they progress uncertain periods. You can't really be certain how fast it's going to progress. So all these things can be quite difficult. When you're dealing with all these issues, then we get our children many times, maybe every 2 to 3 months, sometimes every 2 to 3 weeks, we ask them to come to clinic. We do frequent blood tests, so it's not very nice for children. So what it actually implies, dealing with all these issues, the clinical area, what we present should be welcoming, will be inspiring. And of course, they're not going to lower their pain or stress, but it goes in some way easing, calming their tension, their stress. So that we should be able to provide. Okay, next one, please. So what I'm just trying to see, just told you, just to sum up, What we want things to be done to the CKC is everything is driven by patient and family needs. So everything based on facts. The space what we're going to offer them should be, it should be safe. We got to better utilize whatever the space we have. As the space can't be extended anymore, we got to intelligently use the space. And whatever the area, what I was just telling you, should be patient friendly, welcoming and inspiring. That's it. Thank you. I'm happy to take any questions later.
Thank you, Shiv. That was great. Now, next we'll be hearing from Alison Oliver.
Thank you. Afternoon, everybody. As I was introduced, I'm Alison and I'm a critical care nurse for children by background, but I work very closely in the Children's Hospital with my capital planning colleagues. I don't actually work in capital planning. So what I tend to do is be the link between capital planning, estates and contractors to explain what the requirement is for clinical need, so that when we do any new building, new scheme, that it's fit for purpose for patients. So a few years ago, I was approached to help when the team moved the renal hemodialysis service upstairs, as Shiv just talked about, and look at the unit downstairs to see how we could reconfigure that area. And I've just put some photographs on slides so that you can see for yourselves what environment we're working in and what areas specifically we want to improve for the children. So this first slide is showing you part of the hemodialysis treatment room, and you can see in there that we've got some of the old hemodialysis plumbing that's still going right the way across the room. Configured in rather a strange way, but I think this was put in retrospectively. We tried to disguise it with the bold paint that was used on the wall at that time when we redecorated in 2010, but it's still very evident it's there, and it's now defunct because we don't use it for that purpose any longer. So we're hoping to remove that. Is a small issue there, but it's significant that it makes a big difference to the aesthetics of that room. And there's also these ventilation fans that were put in when the room was first built in 1999 and are no longer in use. When you go around with any of the capital planning officers, what we look at are the mechanical, electrical functioning of the area, and a lot of the items that were put in 1999 are no longer fit for purpose. So a few of those have got to be changed to modernise the area. That's fine, you can carry on, go to my next slide. So this one I took, it's the same wall that we're looking at, but it's to show you the lack of natural light we're getting into the unit. It's multifactorial. We occluded the windows anyway for dignity of the children while they're in here when they were having hemodialysis in this room. But UHW is a vast site, and they're constantly building on the postage stamps that are left within the building to try and get additional services, because healthcare is evolving all the time. So they have put quite a large, significant building next door to us, which has blocked out any natural light that we might have had in this area previously. And I'll talk to you later about why we, or some of the ideas we've got to improve upon that. I did say when I talked about this previously, my mobile phone is made so it lightens areas, so it doesn't give you a true reflection of just how dark these areas are. So if I could go to my next slide, and this is a prime example of this, because this is the waiting area and the play area, which is integrated. And if Rian's on the call, she might not actually recognise this as her own department because it's lightened it up tenfold, really, because that's the way my phone works. So the lighting is home style lighting. They're all downlighters, and it makes the clinical area quite gloomy, along with the bold inspired paint colours, which were no doubt took a long time to choose, but they make the area significantly darker, along with no natural light coming into the area. So if I could look at my next slide as well, please. So this is also showing the consultation room. So all the consultation rooms have similar styles, similar colours, dark colours, and they have very little natural light. So we would want to improve upon those. And then you've just got a glimpse of the flooring there in this picture as well. And this was very innovative when it was first set up and put in the 90s. But a lot of areas within the department are no longer infection control compliant. And sadly, this style of lino could potentially harbour bacteria within all the cutouts in it. So it's no longer permitted by our infection control department. So we'd like to replace that as part of the upgrade of the department as well. If we could look at the next slide. And then all the plumbing that was put in some time ago, we would want to review that, and that was included in the price when we reviewed the area as a whole. But you can see that the decor in the area is quite tired, and that is a microscopic little room with everything popped around that microscopic little sink. And obviously we can't change the footprint, as Shiv says, but we can make it more user friendly. So that is what we'd look to do in all areas, including the sink and the scrub areas and all the consultation rooms. We could go to the next slide. So this is where you first come into the door of the children's kidney unit, and you walk into the reception that is very tired now with outdated information on the front desk. Not a good reflection for your first view of where you've come to the Cardiff Specialist Centre for your treatment. So we would definitely want to replace this area and all the ergonomics behind that desk that Shiv's already shown you the photographs of. Next slide, please. What we would hope to include in this is the front-facing part of the corridor. So the corridor to the left is where you enter into the renal unit itself. The design was chosen some time ago. There's mixed feelings about how that design works for everybody, but the information that's underneath it is now outdated, and we would want to change that. We haven't decided on how you would like that designed or how you'd like that to look as yet, but that left wall we would definitely want included in the upgrade when we have Community Health Council reviews of both this area and another corridor I'll show you afterwards. They do comment that it isn't that welcoming. We have enhanced the signage so you can actually see where the unit is. But we would very much like to enhance this part of the corridor as well as part of the scheme. Next slide, please. So this is where the corridor that comes from the Children's Hospital takes you into the renal unit. Again, this is another corridor that's exceptionally dark, and the reasons for that will become clear in the next slide, if possible. Oh, was there one before that? Oh, don't worry, stay on that one. So this is the Children's Hospital one, and this takes you into a slide that I've got on mine, which is missing on this one. And that has a glazed partition, but that glazed partition is blocked off in the corridor that goes directly to the renal unit. And that's why we're hopeful that you would be able to fundraise enough to improve that corridor as well. But that would very much be if that was affordable. We requested that as an add-on, and our priority would be to improve the environment for the Children's Kidney Centre in the first instance. So if we could have the next slide, please. So this is what I was alluding to as the natural light suggestion that we were coming up for the ceiling within the clinic area itself. So this is just lighting, and you can have variable schemes on it, but this is one of the schemes, the sky scheme, to give some natural daylight in the unit to make it a little bit brighter, and that will help patients, staff and parents and visitors to the unit, because it is quite dark and dingy in there to be spending a whole day doing clinics. And next slide, please. This is an example of a similar scheme, but that's obviously quite considerably more expensive because that's the whole ceiling with that autumnal scene, but it's to make that austere treatment room a lot more friendly and a nice light environment. Certainly if the person, I know these children are coming in and sitting, they're not lying on the floor, but it will make it a light and bright place to visit. And then following on from this are the slides that I've included of a scheme that we've just, I'm terribly sorry, that we've just upgraded in another part of the hospital. And this is Rainbow Ward, so the Children's Oncology Ward. And if you could just show the next slide. And this is just to show, this is a health building note compliant department. It isn't completed yet, but it's got ambient lighting within the scheme. It's got the cabinetry, which the staff are exceptionally keen to have in the new renal unit. And that is about making sure that the unit is IP&C compliant. And it just makes everything about the treatment rooms, etc., a lot better to provide care. It just keeps the place clean and tidy. In the treatment rooms, it's less frightening for the children because there will just be toys on display. There wouldn't be the items that the staff will need to provide clinical care, which you don't really want to see if you're a new child coming into the unit, and certainly if you're a parent that's going in maybe to visit the unit for the first time, or the children that indeed come to visit for repeated blood sampling, etc. Next slide, please. And this is just to show you one of the decorative walls inside one of these clinical rooms. And these are all made with what they call digiclad. So they're all plastic walls. So they're washed down. And again, that makes the rooms infection control compliant. And then the walls have an enormous amount, although you can't see it, of 3/4 wall protection on them to keep the rooms clean, so that you can just wash the walls down after people have visited, so you're not having all the chipping, etc., that we've got on from the chairs that are currently in the waiting areas. And next slide, please. And that's just showing another room from another angle. Next slide, please. This is the treatment room. So this is to show all of this cabinetry came out and was all replaced. So it's all sealed. They used to lose some of the items from the window. They used to lose down the back with syringes, etc. And all of that has been bespoke made so that it's made for chemotherapy, which obviously is different specialism to the specialism you'll be providing. But the treatment room would be fit for purpose, and lots of the areas would have closed cabinetry. Next slide, please. Again, very similar with some ambient lighting in it. And then the final slide is a similar picture of, again, the difference that lighting schemes can make to quite an austere clinical environment. And that's all I have to say. So I'll answer any questions at the end as well, if possible. Thank you.
Thank you. So next, we'd like to hear from Julie Main.
Thank you, Nicola. Next slide, please. So as Nicola mentioned, I'm Julie. I'm mum to Ffion. Ffion was diagnosed with Manser-Cervino syndrome when she was 5. This essentially means that she's got problems with her eyes, her kidneys and her bones. She had her kidney transplant in February of this year and she's doing really well. I'm also chair of the Paul Popham fundraising committee. Next slide, please. So when I was asked to take part in this webinar, I did some research and I discovered that first impressions count. Did you know it takes 1/10 of a second for someone to make a judgment about someone or something, and most likely that impression will never change. When you walk into a bank, for example, you know that your money is safe because the setting is well presented, and this gives you a sense of security. Several studies have also found that the physical environment in a hospital has an impact on health outcomes such as patient satisfaction, stress, and overall healthcare quality. I'm confident that you'll also agree with me on 2 things. 1, that you want the best for your child, and 2, the care provided by the team at the Children's Kidney Centre is second to none. Unfortunately, this isn't reflected in the outpatient area, which is now in desperate need of updating since it was first opened in the 1990s. In a typical week, around 50 to 60 children and their families visit clinic. When you visit clinic with your child, an environment that puts you both at ease while you wait to be seen can have a significant impact on your well-being and overall experience. This is even more so important when your child is newly diagnosed and you are both anxious about what lies ahead of you. Next slide, please. So for us, the improved lighting after the refurbishment will benefit Ffion. As I've already said, Fion's got problems with her vision. She's got very poor peripheral vision, so she can see very little when she comes into clinic. So this improved lighting will make her visit to clinic safer and more enjoyable. As Shiv has already said, not every child has kidney disease. She also gets really anxious while she's waiting to be seen, especially having blood tests. So an environment that puts her at ease will also help to calm and reassure her. The improved facilities will also make the environment for everybody within clinic something for them to be proud of. And the nursing staff will also be able to reflect this with their hard work and positive attitude to the parents and children who are often anxious about clinic examinations. The refurbishment will also create more space to accommodate the existing COVID limitations, and the environment will be bright and colourful. Will also put parents and children at ease, and there'll be private space to accommodate talking to nursing and reception staff. This is really important if discussing something really quite confidential. The environment will also then be a home away from home. This is something which is really important for us. When you come in, you're really anxious, and something that makes you feel comfortable is a big impact. I felt it was so important to have a clinic area which is exceptional as the staff that care for our children, that I joined the fundraising committee as chair so I could help achieve this goal and make changes for current and future families. I'm also happy to take questions at the end.
Thank you, Julie. That was brilliant. Last but not least, Joanne Popham from the Paul Popham Fund. Here we go.
Thank you, Nicola. As Nicola says, I'm Joanne Popham, CEO of the Paul Popham Fund. My presentation today is just going to explain why we're involved in the project, and I think you can clearly understand from Dr Hedge, Alison Oliver and Julie Main exactly that. Next slide, please. So today I'm just going to explain and introduce our involvement with the refurbishment project. I'll provide a history of the charity and run through our aims, mission and objectives. I'll briefly explain what we do as a charity to support all those affected by kidney disease in Wales, and I will then specifically explain how we support children and youth with kidney disease and their families. I'll then give you an update on where we are with the current project, our plans for the project next year, and how you can get involved, and finally who the team are that support the children and youth within our charity. Next slide, please. So how did we get involved in the children in the refurbishment project? In 2018, I met Dr Krishna, who showed me the plans for the outpatient department. So that's nearly 3 years ago. That same year, Dr Krishna attended a trustees meeting where he presented further information on the refurbishment of the project. Following the presentation, our trustees visited the Children's Kidney Centre and were shocked to see the area that the children and their families had to visit for their outpatient appointments. They felt that to have such an illness when young is hard enough to cope with, to then come to a support clinic that is dark and gloomy due to very little light is quite distressing. So sympathy was also felt for the clinical team who work within the unit on a day-to-day basis. After the visit, they requested full details of the cost from Alison and her team. At the end of 2019, the final costs were presented to the board, and in January, our trustees felt so passionate that they agreed to support the Children's Kidney Centre and raise the funds for the refurbishment project. They wrote to Capital Planning to confirm that the charity would be pleased to support and raise the total needed of £132,000 at that time. Lynn Norton, our chair of trustees, said that as a parent, I can't imagine how devastating it must be for children to have a serious condition like kidney failure. to then have to take them to a dark and dismal place to have treatment tests, that just exacerbates the situation. This is why I and the Board of Trustees at the Paul Popham Fund are proud to support the fundraising initiative to raise monies to refurbish the Children's Kidney Centre in Cardiff. The renovation of the Children's Kidney Centre will ensure a brighter, more welcoming place for the children to visit, improving the whole experience for them and their parents. The refurbishment will make such a difference, and it fits with the charity's aims of improving the quality of life of children and youth with kidney disease in Wales. Sadly, after that, COVID hit, so we're slightly behind in our fundraising target. The next slide, please. This is one of many projects and services that the charity supports. To explain what we do, I'll give you an overview of how we started. The charity was set up in memory of Paul Popham. Paul had kidney disease for over half of his life, and he did not let the disease define him. He was on home hemodialysis, had 2 transplants, played football, worked shifts at Alcoa while bringing up a small family of 4 children. The charity was set up in 2013 with his spirit in mind to encourage all with kidney disease and their families and friends to believe in themselves and to improve their quality of life. Family and friends of Paul met in an inaugural meeting on the 13th of March 2013, and the initial focus was to provide items to Morriston Renal Unit that would improve the patient's quality of life. Following that year and into 2014, we funded items for Morriston Hospital and also the Children's Kidney Centre to include a dialysis chair and iPads. And in 2015, the charity became registered with the Charities Commission. The charity's aims, mission and vision have remained pretty much the same throughout the last few years. Our aim is to support children, youths and adults with kidney disease to lead a better quality of life. We do this by putting patients first, improving their financial, physical and emotional well-being, and improving their knowledge through education. And that is clearly stated in our 6 objectives. Next slide, please. So what do we do and how do we do this? Next slide, please. Emotional well-being is through our peer support service, where we train current patients and their families to become peer mentors to provide information, advice and support to new patients or those going through changes in circumstances. We also provide a counselling service to those experiencing more anxiety or depression. Our volunteer peer mentors also facilitate a care line, a telephone answering service for people with kidney disease and their families. We facilitate various informal support groups called kidney cafes, and we also facilitate an online support group, which are closed and confidential. And we are in the process of looking at a youth club for the children's kidneys, for children and youths. Next slide, please. Financial wellbeing is provided through patient grants. They cover things like cookers, fridge freezers, utility bills, food and travel. We also fund music costs, laptops and other items that will improve a patient's quality of life. Our current grant scheme is restricted to a value of £150 per patient. However, the grant committee will exceed this on an individual and case-by-case basis. Next slide, please. We also try to improve and support physical well-being. We support the transplant games, and we've also established an exercise for health group, which has been facilitated by one of our volunteer peer mentors to encourage all to get active. Next slide, please. We also aim to improve knowledge and education of those facing kidney disease so that they can make informed decisions about their treatment choices and living well. Through a new initiative, a kidney cafe, information and support for new patients. It's a 9-session programme that includes information on introduction to CKD, which is chronic kidney disease, to treatment choices, diet, medication, living well and well-being. We also organise Q&As on various topics, bringing a clinician and a peer mentor together to answer various questions and challenge barriers. We support a newsletter that was born out of the pandemic, collaborating with the main charities in Wales and the Welsh Clinical Renal Network to provide up-to-date information on kidney disease and services available to all. We also collaborate with those charities on a series of educational webinars, and we'll be hoping to provide an in-person conference as soon as it is possible. And during the pandemic, we provided a newsletter called Kids, collaborating with the Children's Kidney Centre to give up-to-date information. Next slide, please. And finally, we support various wellbeing projects for our kidney community. An activity weekend for children to Newgale, which is run by Sean Thomas. We fund Christmas Day Out for families with, of children with kidney disease. We have funded a family and sibling day prior to COVID, and we have funded various items for hospitals and units. Next slide, please. So all those initiatives support also support children and youth and their families. I mentioned our Kidney Cafe initiative. One of those is called the Parents and Carers Kidney Cafe, bringing together parents of children with kidney disease to support one another. Next slide, please. I mentioned we provide grants. Families of children with kidney disease can apply, and also can youths. And these are signed off by Jo Ffion in the main, who is the paediatric social worker currently. And we funded applications that include travel costs to hospital, nursery costs, laptops, food, utilities, bed frames, mini fridges, rent, and more. Next slide, please. We supported the children and youth to attend the Transplant Games from the British, European and World Games since 2016. In 2019, we supported Sean Thomas and Laura McGuinness when the Games came to South Wales, helping to recruit, fund and facilitate the Games with the biggest team in a long while. And it was in Cardiff. And we're hoping that this legacy will continue as we come out of the pandemic. The next slide, please. As mentioned, we've collaborated on a newsletter called Kids, and that will continue post the pandemic, where we have various collaborators, from a spotlight on a professional working in the Children's Kidney Centre, from activities provided by the centre's teacher, Isabel Thomas, to information on recent COVID-19 guidelines and more. You will also find up-to-date information on the funding for the refurbishment of this project. Next slide, please. Since 2015, we've been taking children and families to see a show at Christmas, and we're absolutely delighted that finally this year we can take 85 to see Beauty and the Beast at the Wales Millennium Centre. Next slide, please. So the refurbishment project, as well as all of this, we wanted to support the Children's Kidney Centre with the refurbishment of the outpatients departments to bring light and a welcome to all those visiting the centre when sometimes it can be a difficult time. We recruited, as Julie's mentioned, a fundraising committee in 2020 to help support the project, made up of Julie, who chairs the committee, Tamsin Paget, another mum, and various other volunteers. As you can imagine, it's not been easy to start the fundraising project during the pandemic. However, the drive, passion and enthusiasm of the committee have managed to raise, or will have raised, 30,000 by the end of this year. This has come from a virtual walking challenge, a kilometres for kidneys, which Ffion took part in, a golf day last year and this year, various schools' involvement with Christmas jumper day and walking challenges, and Hugo and Jude, Tamsin's children, braved the shave. They chopped their hair off. Julie Main herself did a CrossFit challenge in fancy dress, and she was definitely a super lady. And Harry Weir and family climbed Penavan. We held our 2022 calendar competition, and recently Ebenezer Church has fundraised over the last 2 years and raised 6,000, which we've just picked the check up this weekend. Sarah and one of the children's parents attend the church, which is just overwhelming to think that they've managed to raise that much during a pandemic. Next slide, please. So plans for 2022 are that we have a Christmas jumper day and quiz at the end of this year. We've got a spring ball at the Coal Exchange on the 12th of March, which is just after World Kidney Day, and it'll be hosted by Sean Lloyd. Kilometres for Kidneys will be also taking place at the start of World Kidney Day, again for 1 month. There'll be corporate support, pledges, a summer ball, a football tournament, supermarket collections, and race entries are starting to open. Next slide, please. Anyone and everyone can support the project, from as little as much as anyone can give or help. From joining our fundraising committee to just spreading the word, carrying out your own fundraise initiative, taking part in one of our events, donating or running, the choice is yours. Next slide, please. So to find out more from us, as you know, I'm Joanne Popham, I oversee the charity. Kyla Thomas, who's hosting today, is the Children and Youth Support Coordinator and facilitates all children and youth patient referrals. Anna Powell, our volunteer coordinator, recruits all volunteers and looks after their needs. And Hayley Evans, our project and administrator coordinator, supports all internal projects. So thank you for listening.
Thank you, Joanne. I'm just, sorry, it takes a little while on my side after someone's spoken. So next we'll be moving on to the Q&A. We've had 11 questions submitted. The first one being, what renovations are included in the refurbishment? So I think this is one for you, Alison.
Yes, I'm happy to answer that. So as I've briefly gone through, there'll be the entire unit will be refurbished for flooring, lighting, so any electrical and plumbing will be reviewed. I think the only thing that we didn't include were the consultation doors, but every other room in the entire unit will be upgraded, redecorated. There'll be a new ceiling put in so that we can put the ceiling tiles in with the lighting in addition. And then there'll be the different cabinetry in the different areas, a new reception desk, and far better ergonomics behind that reception desk, so it works for not only the coordinator but anyone who needs to work behind that desk.
The next question is, £130,000 seems a lot of money. Do you think children on dialysis need it the most, as they are the ones dialysing for hours with nothing much to do? So I think, is this one for you again, Shiv?
Yeah, it's a good question. You know, if we have a choice, we do everything. That would be fantastic. But with what the resources available, we got to see, you know, it should be useful for maximum number of patients and families. Obviously, Children Kidney Center is used by a lot of children. You know, as I was telling you, we see about 50 to 60 children minimum every week. So what we do for CKC would help a lot more children. Fortunately, not many children end up being on dialysis. So in future, we want to do more things for children on dialysis. But at this point of time, you know, the place where these children are seen in Children Kidney Center, as you heard, is not being given attention for the last 10 years plus. So the children dialysis unit recently has moved upstairs to a new hospital. So the environment over there is much better, but we could certainly look into that in future to see what children can do better during dialysis so they enjoy their time.
Okay, so the next one is, children are also missing out on schoolwork while dialysing. Can you fund a teacher full time?
We can certainly investigate what this particular question's alluding to, because obviously there is school teaching that local authority provide for the Children's Hospital, and if you're here for a certain number of hours, you have to have education while you are resident in the hospital, including the dialysis children. So we can certainly look at fulfilling more hours if there's a specific issue, but there are school teachers on site and you know, we have to provide that while they're here. You know, there's not a huge enthusiasm when the school teachers attend and go into the day dialysis unit, I have to say, for an engagement. If they don't feel up to it, they can get out of their work fairly easily, I would suggest. So I know that when she suggested maths a few weeks ago, somebody just went under the blanket. No, thank you. So we'll certainly provide more if it's required.
Yeah, sorry, can I add something to that? At this point of time, we provide teacher half an hour per session per child. So that they already get at this point of time. Yes, we can certainly, if the duration can be increased, that will be very welcome.
Okay, so a lot of children on dialysis have problems with their legs. There was talk of a bicycle pedal once to get them to exercise, but there was no funding for that. Could money be spent on this?
That's one more good question. So this idea has been tried in many adult centers first, and then in some pediatric centers. I brought that idea to the unit a few years ago. But once you get into the nitty-gritty of it, what it is, it's not just buying bicycle. In theory, these children are dialyzed for 3 to 4 hours. They don't do much, so it'll be really good if they do something. You know, it's good for their health. Yes. So the studies have shown it does help, but to bring it into practice and to do it in a way which is safe, there are certain guidelines. So in addition to the getting bikes in place, which cost many times thousands plus, the exercises are supposed to be prescribed by physiotherapists. They're supposed to be monitored by them. So the way we can do it safely, it needs quite a lot of things in place. One is having a bicycle. We need to have age-appropriate children who can do this. And number 3, a running contract with the physiotherapist who can, every dialysis session, who can come there, prescribe the exercise program, and they need to monitor it. And if the children are doing better, they can increase how much exercise they can do. So the physiotherapists at this point of time, they're not funded for that. So unless we get funding, not just for the bikes, but also for the physios contract and the running contract, that is, only then we can look into this specifically. Just a word of caution at the end. Some of these children have got bad bone disease. So if we ask them to do vigorous exercise without proper safe monitoring, you know, I was just telling you, they are got bones which can easily fracture. So we got to be careful about that. So we got to do it in a safe way. Yeah.
Thank you, Shiv. Next one is, I personally think that no matter what the room colours were like, it would never take the stress away. It seems there's such a lot of money, especially when you're in and out of clinic. So.
I think that was for me, wasn't it, Michaela? Yes, even though the paint on a wall will not take the stress away, it can certainly change your impression when you go into clinic. Something that's bright and child-friendly will give you something to take your mind off while you're waiting to be seen. It's also been proven that certain colours can relax you. For example, blues and greens are a lot more calming than if you've got too many bright colours. So it definitely makes a difference, I would say.
Thank you. So the next, do you think that £132,000 could be better spent on researching kidney disease and treatment?
I don't think we agreed who was going to answer that one earlier, but
Yeah.
It is a large amount of money. However, I think it is part of treatment to have a environment that is welcoming, that is enjoyable as it can be for the children and their parents. They do spend a lot of time attending outpatients, but it would be for the charity to decide what the priority was. And I think, as Joe alluded to, when they visited some time ago, they were disappointed by the environment. The treatment that we give is excellent. Very biased there, but we would want the accommodation and the experience for families to match that, really, and that's what we're aiming to do through this project.
Can I just jump in there? I think for our charity, we don't actually invest in research. There are other charities that particularly are focused on that. And then they would sort of would run research. So we're focusing on what we do, which is improving the quality of life of patients, and this definitely will do that. So as Alison said, we are pleased to be supporting it.
Okay, can I add just a sentence to that? It's a good question again. You know, research in children with the kidney disease is really very interesting area and a very highly essential one, because there are many kidney diseases and there is no treatment. So that area is something which is being given increasing importance. But the issue for that is, you know, it is a very small specialties. Fortunately, the number of children who get a kidney disease in the wider context is not that high. Okay, so if you want to do a research, you need a lot of children. So these researchers have done many researchers like that, is either nationally or internationally. That means you need more children to do that. That you can only do it when you do that together with other units or sometimes other countries. So there are certain charities who contribute, as Joe said. It is a slightly different area. Of course, at this point of time, as we speak, we are also participating in a different research we do nationally with other units. So that happens side by side. Yeah.
Thank you all. When is the refurbishment going to start? I think this was one for you, Alison.
So I'm keeping in close contact with Joe and how the fundraising is going. You'll be well aware that we're amidst a pandemic, and our own capital planning is currently inundated with projects. So we haven't given a time frame because we obviously came up with the price once we costed the project, and COVID has obviously affected the speed of fundraising. But we, you know, the charity has been very successful to date, but we have no urgency at this end because the capital planning have told me this week that they're carrying 75 additional projects in addition to what they would normally be doing, which would probably be the same number. So they won't be anticipating a start date for this soon. So currently in my head, I'm looking at 2023-24, and we will continue to monitor how the charity's going along in that time frame. And then I'll update you nearer the time when we can see that we're progressing towards the finish line. I do appreciate that with inflation and that length of time, things might alter somewhat. So we will need to review the corridors, etc., potentially.
Yeah, and I think the trustees are keen to understand what that inflation will look like, but we'll wait until until we come into the end.
Okay, so how long do you think the refurbishment will take?
I'm anticipating about 6 to 8 weeks, but currently, again, everything is being delayed with COVID. We don't know what position we'd be in by the time we get round to the building works, but all materials are delayed coming from across the world at the moment, but also contractors. It's very unpredictable. They're under great pressure, huge demand, and also the workforce can't be relied upon because of people having to go off short term with COVID contacts at the moment. So that would be the aim, 6 to 8 weeks, but we will review that nearer the time.
Okay, the final question that was submitted was, when the refurbishment is in progress, where will treatment and appointments be relocated to?
And again, there will have to be a substantial plan for that, and that will be made with capital planning, because Shiv and all his colleagues will need to deliver a like-for-like service in an equitable clinical area, and capital planning will be fully aware of that, and we wouldn't start the project until we had an alternative clinical area of the same specification, and that will be located in the Children's Hospital again.
Yeah, just to add to that, 10 years ago when that refurbishment took place, so I was around, so we found a space where the general pediatric clinics were done. So we did the clinics over there. Obviously, it wasn't, it didn't take that too long. So it is doable. We have done it. Yeah.
Thank you both. I'm just going to stop sharing my screen and just check the chat function, the Q&A function. So that's all questions for today. I'd just like to thank you all for speaking. It was really insightful to learn, more about the refurbishment for the Children's Kidney Centre, and also to really emphasise why it's important for both patients, staff, and families and parents. And it was really exciting to see some of the examples, of how the refurbishment's going to look and what we can look forward to, which is lovely. And, the general atmosphere of the Kidney Centre and how that's going to change. So yeah, special thanks to Dr Hedge, Alison Oliver, Julie Main and Joanne Popham. Diolch. Thank you.